I know that Bavard is about sort of your passions, and they're very easy for me really to cover two of my main passions, because being a songwriter, music is massive. For better or worse, I'm a songwriter, so one of my passions is music. And the other, I've developed a passion over the last 10 or 12 years for mental health and social inclusion, which sounds really, really heavy and all that. But it's got a real history to it. And I'd just like to maybe cover a bit of that history. I've got to let me do that too, in terms of the mental health and happiness and everything in music, because it's actually the title of a book I've written about mental health and social inclusion. And that's quite a sort of movement in its own way. It's an idea whose time has come and it's developed over the years. And I've thought how shift happens. And ideas whose time has come maybe take 50, 60 years for them to kind of emerge and come up and then develop that sort of tipping point where they become sort of, yes, that's what we need to do in this particular field. So that's how shift happens. Does anybody recognise this lady here? You may recognise it. You may even recognise the gentleman behind her. It's
Rosa Parks.
Rosa Parks, yes, thank you. As probably everybody knows, she's a lady who stood up to a bus driver in Montgomery, Alabama in 1955, because there was a segregated area for, as they call them, colours and white people, and she was tired at the end of a long working day. There was a free seat in the white section. She took her seat, quite reasonably, and it caused a furore. You can't have you sitting in the white section, segregation, that's the law. And it became a massive civil rights case, which she pretty much won. And I think she's been really, really important in this whole social inclusion movement, including social inclusion in mental health. And another lady, not so well known as Rosa Parks, is a Canadian lady called Pat Deegan, Dr. Pat Deegan, and at the age of 17, she was sectioned. She was put into a very traumatic experience to go through at any time of life, but she was put into a mental hospital, and she was given a medication, she was given a diagnosis, a label, paranoid schizophrenia, whatever it was, and she was told you're going to have a rather limited life from now on. You'll probably be on benefits and you'll spend your time in halfway houses and drop-ins and day centres, and that'll be your life. And she was thinking to herself all this time this was going on, well, just a minute, I've got gifts. I've got natural gifts and gifts I've worked on. I'm an athlete, a sportswoman. I've got this sexuality which is important to me. And she thought to herself, she had this thought, and the thought was, I'm going to work in the health system, become Dr. Deegan, so that people don't have to suffer anymore. And she had that thought, but she kept it to herself for a very good reason, because she knew if she disclosed it to the medical team, the clinical team, the psychiatrists, she'd be labelled as delusional, up the medication, and it would have been like that. She couldn't disclose her own authentic self. She couldn't disclose what she's passionate about. And so she said, I'm going to change the mental health system, I'm going to become Dr. Deegan so that people don't have to suffer anymore. And she's very important in this whole movement of social inclusion in health, mental health included. And then, sort of moving on very quickly and compressing all this, we move into sort of, I suppose it's the late 2008 was when that research came out, which was called New Horizons Research. And the government realised that an awful lot of money was being lost, like billions of pounds, both in the public sector, private sector, commercial sector, because people were turning up to work and being unproductive. They had presenteeism, they weren't absent necessarily, they weren't taking time off sick, that was part of the problem, but they had presenteeism, which meant turning up but being totally unproductive because they weren't happy. And the government felt we're going to have to address this. Everything comes down to financial things, but there's billions of pounds being lost. So they've got this research called New Horizons Research, and one of the wonderful sort of statements that came out of it, which I think is crucial, is recovery takes place regardless of symptoms or problems. And what that means is that if you've got a diagnosis, you've gone through a mental hospital, and you've got this long-term diagnosis, this label and everything else, you've got a pathway of managing it, managing your condition and living with it maybe for the rest of your life. Although there is such a thing as full recovery, it's not unheard of. But it's not going to have to stop you from doing the things you want to do, the things that you're passionate about, whatever they might be. So to me, that's a very liberating phrase. Recovery takes place regardless of symptoms or problems. And that's just a kind of coaching tool, which doesn't say very much, but I'll come to it. But what that statement meant was that we could start assessing people who come through the mental health system with long-term mental ill health and say to them, not what's your label, how do we approach your diagnosis, what pathway we're going to kind of prescribe for you, but we can actually say, what do you want to do with your life? What do you want to do in the mainstream world? What do you really want to do? So I was part of this because I worked with an organisation that was commissioned by Public Health to do this mainstream inclusion work with people with long-term mental health conditions. And I was very fortunate in being what we call a bridge builder or coach in the sector of the arts, which is obviously a dream job for me because I'm into the arts. So I was talking to people and saying, what would you want to do? What would you prioritise? And they tell me, well, I'd like to go down to the recording studio. I want to work on my music. I want to exhibit my paintings. I want to sell my paintings. I want to learn creative writing. I want to do a course in photography. And these are people who maybe have been kept out of the loop for years. They could have been very successful previously, but the trauma of being sectioned and everything else, a breakdown, had kept them out of mainstream life. But for the first time, being back in mainstream life was seen as part of the recovery pathway. So it was like a clinical intervention based on asking people, what do you want to do? And I got so passionate about it that as an approach to mental health, that's kind of diminished a lot now. It's not funded in the same way. The trends have changed towards things like advocacy and peer support and everything else. But I've always felt that this was one of the best approaches with one of the very best outcomes. So that's why I'm still banging on about it, I'm still passionate about it. I want to see it brought back into public health. I want to see it brought back into the wellbeing programs that companies have, where somebody has a bit of stress at work, they may be entitled to 6 weeks counselling or therapies. I want to see them get life coaching as well, because I can guarantee that 50% of the people who present with problems which they're being kind of sort of prescribed therapies and counselling, they really do need a coaching outcome and a coaching approach. So that's why I'm passionate about it, because it still needs to be re-established. And that's my passion. It's mental health, social inclusion. That's another coaching tool. The different sections on there are geared towards people to enable them to get to those areas in life they may have not been able to access, like family, neighbourhood, arts, culture, education, employment. It's not prescriptive, because if somebody doesn't want to do anything in any of those areas, they don't have to. But once they've identified areas they wish to prioritise, then the bridge builder's job or the coach is there to direct them to those areas and maybe provide a bit of mentoring. So if I get a client who wants to do music, it's my job to know what's out there in the mainstream community. And my other passion is music. So let's do a song. I think there's time.
There is.
It's a funny thing on this side of it.
What's that?
I said it's funny being on this side of it.
Oh, okay. It's funny being on this side. That's a song I do called Mastermind, and it's about everybody kind of linking into one mind, which can kind of happen, ideally. I'm looking for my mastermind. I want to pay my dues, I don't want to be unkind. I'm looking for my mastermind. And it's done with skill, and it's done with care, and it's given to those who dare. those who dare. I'm looking for my mastermind. I'm looking for my mastermind. See the sun, see the sunflower. She follows in all her lord of the hours. She's looking for her mastermind. She's looking for her mastermind. Thank you.
I've come up. Was that the end? I'm just checking because you said you are right. Brilliant. Well, thank you very much, John. I'm just checking. John did say you're going to finish with a song, so there we are. Fabulous. Now, John, if you want to take the centre. Does anybody have any questions for John and anything to do with music and health, which, as you said, was linked to not intentionally linked on my part. I have I have a very light curational touch on the talks. In fact, I have no control over anything. So there's no planned link with the Bavard Bar. You just never know what you're going to get. So there were two talks that I suppose they were. Well, not that similar, but there were themes that were
Complimentary.
Yeah, definitely complimentary. So, any questions arising from that? And if not, then
I was going to say something about social prescribing. So that is happening. What do you know about social prescribing and how that links into what you're talking about?
Well, I can't knock social prescribing, but to me it's a little bit the same old model. You prescribe something for a diagnosis or a disorder or something. So a little bit uneasy with that method of doing things. Is it coming from the person who's being prescribed?
Sorry, social prescribing
Is everyone clear what
is this prescribing some kind of...
It's what health visitors used to do informally for years and years and years. It's rebranding something that's actually happened for years, but the government are paying for 1,000 new link workers so that you go and see your GP, and your GP realises that the reason you're going is not necessarily due to a diagnosis, but more to do with your lifestyle and everything else that is a result of what's going on in your life. So you go and see a link worker, and the link worker says, have you thought about going to it? What do you like? What are you into? Have you thought about doing any gardening, or you like knitting? There's a knitting club, or have you thought about cooking or sewing, or
They've just started this in France, I think. They restarted this in France.
It's huge here, but I was wondering what, it's kind of similar to what you were...
Yeah. I just think the word prescribing keeps things in the hands of the clinical professionals.
No, it's social prescribing. They play on the words.
It's prescribing, yeah. I mean, people should tell us what they want to do, not be prescribed things.
But if I wanted that service, or to take up that service, what would it be called for me?
Probably called coaching. It used to be called bridge building.
Right, coaching.
Yeah.
So I could go to my GP and he'd say, I can refer you, or...
Yeah, you could, yeah. Actually,
to a coach.
That's a really good point. Yeah. I think there's a way to go with convincing society in general that counselling and therapies are not the only way. So there's a bit of a way to go with that. Yeah.
Any more questions for John before we take a break? Okay, in which case, can we thank John for another...